Well, John, I'm just delighted that you recovered so well from the initial phases following your heart attack. We've gotten all the reports from the cardiologist. It looks like your recovery is going well, and I know you're started with your exercise program and rehabilitation. And I've reviewed all the medications you're taking. I'm very satisfied with the program that you're on. One thing I wanted to make sure that we talked about today was your risk for depression. One of the things we found is someone who's had a heart attack is at very high risk for developing depression during that first 6 months to a year after their heart attack. It may have to do with the heart attack itself, or in part because of the disability they're experiencing and the major life change that they're experiencing following their heart attack. We know now that it's helpful if we give you some tools to work on, both to be observant to make sure you're not getting depressed, and things you can do that help ward off depression. What I'm going to do today is go get Jennifer Sale. She's one of our behavioralists. She does our lifestyle management and works as our behavioral health consultant. And have her come in today and talk to you a little bit about these issues specifically. It's her specialty. So I'm actually going to give you a couple questionnaires to fill out while I'm gone. One is on depression signs and symptoms specifically. The other's a little more general. You'll see it includes things like, are you feeling anxious, like that. Pretty general. Take you about 4 minutes to do. About the time you're finished with these, you'll see me pop back in the door with Jennifer in tow.
Okay.
Okay, there's those for you to fill out, and I'll be back in just a few moments. Oh, thank you, John. Well, John, this is Jennifer Sale.
Hi.
Yeah.
Jennifer?
Nice to meet you.
Jennifer, as I mentioned, is our behavioral health consultant, our behavioralist here in the clinic, and she's the one that works with our patients on lifestyle management and behavioral health issues. The questionnaires that I had you fill out, it's actually kind of interesting. I've noticed that some of your responses here might show just a little bit of early depression risk, and so I think it's doubly important we make sure that Jennifer at least have a chance to talk with you. She can talk with you briefly now. John's been in our practice for almost 15 years now. He was one of our first donors, in fact, so he's always been a great friend of the clinic, and I'm glad we can be here for him when he's going through this big change right after his heart attack here. So I'll leave the two of you to get at it, and I'll be seeing you for follow-up, and that's already scheduled.
Okay.
So, John, you've just been through a heart attack.
Yep.
Wow. How are you feeling?
A little weak, a little shaky on my pins, just about, yeah.
Yeah, I bet. That can be pretty traumatic, both physically and mentally. Yeah, so your screening did show that there were some signs of depression. And, I'd like to try to help you with that a little bit. This can be a difficult time, There are some sort of preventative measures we can talk about, things that you can do physically that can help your mood and kind of just help you work through it. And there's some different cognitive techniques we can use to help you with your depression. If we can meet regularly for a little while, if you feel the need to, I'd be really happy to talk to you.
That sounds good.
That sounds good. Okay, so we'll go schedule an appointment for you.
Well, thank you.
Okay.